This is Travis Nielsen. I did this study on Buerger's disease. Buerger's disease, or thromboangiitis obliterans, is more medical name for it. Another name for it stands for clot vessel blockage. What is Buerger's disease? It's an inflammation of small and medium-sized blood vessels. Although any artery can be affected, it usually presents with blockages of the arteries to the feet and hands, leading to pain and tissue damage. More common in the lower limbs than the upper limbs, and a lot more common in males than females. The disorder has been described as an autoimmune response. However, the precise triggering antigen has not been discovered. Some of the common signs and symptoms of Buerger's disease is cramping in the calf while exercising, pain in your arms, hands, legs, fingers, or toes, pale red or blue hands or feet, cold hands and feet, numbness or tingling in your limbs, and when it gets a little more severe, skin ulcers or wounds that don't heal on your fingers and toes. In the earlier stages, this kind of comes and goes intermittent, and in the later stages, it's just kind of always there. As the disease progresses and blood vessels become less and less efficient at doing their job, which is supplying blood to the tissue itself will become necrotic and more susceptible to ischemic ulcers and infections such as gangrene, which is very common in Buerger's disease, or any disease where you're cutting blood flow off to extremities, and eventually the finger or toe or whatever tissue is not being supplied by blood will be amputated. So Buerger's disease is very dominantly found in male smoker, tobacco users, heavy tobacco users between the ages of 20 to 45. There's also 5 classifications of Buerger's disease. Type 1 is upper limb, type 2 involving legs and feet, type 3 femoral popliteal, type 4 arterial femoral, type 5 is generalized. So there was a 41-year-old male who presented to his physician that he's experiencing cold feet and pain that comes and goes throughout the day, along with numbness and tingling sensations. He explains that it seems to get worse while working out or exercising. The patient says he has smoked heavily for 15 years, so the doctor has ordered an ultrasound bilateral legs and an angiogram of the lower extremities to check the blood vessels. So here we have a couple pictures of ultrasound in the legs. On the left, there's an occluded posterior tibial artery with thrombus and collateral flow in and around the vessel. On the right, you can also see the collateral flow and the blockage as well there. On the anterior tibial artery in the distal calf. Common angiogram findings of people with Buerger's disease. This is the perineal and tibial arteries. It demonstrates classic findings of multiple small and medium-sized arterial occlusions with formation of compensatory corkscrew collaterals. So the treatment for the patient, unfortunately, there's not a cure for Buerger's disease, but we can manage and slow the progression. The biggest and most important thing someone can do who's diagnosed with Buerger's disease would be to completely stop smoking immediately. It's the only treatment known to be effective in Buerger's disease. Patients who continue to smoke are generally the ones who require amputation of fingers and toes. So the 41-year-old male was directed to completely stop smoking as soon as possible. He was also instructed to perform Buerger Allen exercises, which help with blood flow to the feet. example of this exercise would be to hold your feet, I think it was above your head or heart for 2 minutes, and then below for 3 minutes, then move your feet around, your toes around for 5 minutes, and then repeat position 1. Should help with, I guess, getting blood flow to your extremities, keeping those